Minasan.
Konnichiwa!
Hi, I'm Rachel Bedard.
I'm Bay Wallace.
My name's Damara Lynch.
I'm Nicole Van Hunnick.
I'm Lexi Reale.
And I'm Jessica Gamble. And today we'll be presenting on Japanese culture.
Here's a topic overview of what we're going to be covering in our presentation today. To start off, why we chose Japanese culture. So there's roughly 1.5 million people of Japanese culture living in the United States. Of those, 15,000 live in our very own state of Florida. So it's very likely that throughout our nursing careers, we are going to stumble across someone of this culture while we're working. So understanding their beliefs, their customs, disease processes related to them are very important. So some characteristics of Japanese culture, they have a little bit of a different familiar structure. They have a filial piety structure, which means that they respect and obedience to their elders, essentially. They also have a patriarchal family, which means that the male claims the status of being the head of the household and maintains authority. This has lessened since World War II, but it's still semi-prevalent. Lastly, we have some societal structures. So they are a collective group. They value the group above the individual. So this also is the understanding that individuals will work hard to benefit the group as a whole. And they also like their symbols of collectiveness. So banners, names, different symbols are very commonplace to identify them as a group from outsiders. And lastly, there is a societal hierarchy which is determined based on gender, age, seniority, education level, and employment status.
All right, so continuing on with Japanese culture here, we're going to touch on religion a little bit. In the past, Japan mainly followed Shinto and Buddhist religion that more so disseminated with the implementation of secularism in 1947 with the institution of the Constitution of Japan. Ever since then, it hasn't been as prominent. We also have gotten art from Japan, with ceramics being implemented in the Neolithic era and popularized through home art and the traditional tea ceremony. We also have gotten anime, which is a very respected form of animation in Japan and was actually popularized in America in the 21st century. Continuing on with music, Japan has bred many genres of music such as J-pop, J-rock, Japanese reggae, along with a plethora of other genres. And finally, we're going to touch on some food. Japan's food was mainly influenced through their rice-based meals and cuisines, which implemented fresh fish and other foods and vegetables, and thus sushi was bred, and we all know sushi.
Okay, so some health disparities that affect Japanese culture. It was found that women have a lower self-health rating than men, as did the elderly compared to working age adults, and those with a higher education as compared to manual workers. Some additional indicators for poor health in Japan include high suicide rates and high smoking prevalence in lower socioeconomic populations. When examining health disparities faced by Asian Americans, it seems that it is a high prevalence of cancer and chronic diseases. In fact, Asian Americans are the only U.S. population where cancer is the leading cause of death. It seems that these cancers go undiagnosed until their late stages, which contributes to their mortality. So some nursing concerns when regarding health disparity is, as noted in the previous slide, a huge issue is undiagnosed health concerns. Therefore, as a nurse, I would be concerned with finding a way to implement preventative care and early detection. An important component of this would be community outreach and education to promote health literacy. Finally, caring for an individual of Japanese culture. When caring for an individual of Japanese culture, it is important to find out what to extent they follow their culture's values. Japanese Americans tend to value the use of herbal medicines, also known as Kampo, and tend to put less of an importance on Western medicine and the use of physicians. This is especially important to note because often herbal remedies may interact with other pharmaceuticals and may decrease the effectiveness of medications as well. Japanese tradition also puts an emphasis on using diet for healing and believes certain food groups are essential for the prevention of disease. Therefore, it will be essential that you allow the patient's families to bring food into the hospital to provide culturally competent care. Japanese culture values family interdependence over independence, so it is important to establish a rapport with the whole family. Often the male asserts dominance, so it is important to hold into value systems that the patient may not be making the sole decisions of the family.
Okay, so we are continuing on with caring for an individual of Japanese culture. Japanese culture values personal space and does not value making any eye contact. So it's really important to respect these values when providing care. It has also been noted that there is an underutilization of interpreters in the hospital. So if there is a language barrier that exists, it's vital to provide an interpreter for the correct education and also just so you as a nurse can get the correct information from the patient. Mental health issues are an understudied disparity in Japanese culture and should be handled with care. So moving on to the impact of spirituality and religion on Japanese culture. So in Japanese culture, holistic medicine has a substantial impact on how one controls their health. In holistic medicine, methods are used to treat the whole person. So that includes mind, body, spirit, and spirituality. Holistic medicine includes therapeutic powers that are in nature, having trust in self-healing, combining biomedicine to provide treatment, and also having the individual's own body actually realize that they have an illness. So the types of health practices common to Japanese culture. Some health practices that are common in this culture include Reiki, which is a Japanese technique used to reduce stress and promote relaxation and healing. CAM, which stands for Complementary and Alternative Medicine, which combines Kampo, which is a Japanese herbal medicine, which we heard about before, and dietary supplements. Ishoku Dogen helps prevent and heal diseases through eating a balanced diet, which we also heard about before as well. And Japanese acupuncture is used as a form of treatment for patients in pain. Now, something really interesting about Japanese acupuncture is that it's actually an occupation for people who are blind because it has to do with feeling.
Okay, so the most prevalent diseases in Japanese culture are diseases many of us are familiar with, including hypertension, cardiovascular disease, Alzheimer's disease, diabetes, and cancers. Other conditions and diseases in the Japanese population include Nakajo Nishimura, Hikikomori, and Kabuki syndrome. Nakajo Nishimura is an autoinflammatory disease, Hikikomori is a psychiatric disorder, and Kabuki syndrome is an autosomal dominant condition characterized by mental impairment and congenital abnormalities. For the purposes of this project, we're going to further explore Kabuki syndrome due to its ties to Japanese culture and because most cases of this rare genetic disease are seen within the Japanese population. So, in order for a diagnosis of Kabuki syndrome to be made, a patient has to have either a history of infantile hypotonia, developmental delays, a confirmed pathogenic variant on one of the genes seen in the disease, or a typical dysmorphic feature. The typical dysmorphic features include long palpebral features, eversion of the lower eyelids, depressed nasal tip and short columna, or large or cupped ears. Other symptoms in Kabuki syndrome include short stature, feeding difficulties, cleft palate, hearing loss, immunological disorders, as well as congenital heart defects. The congenital heart defects we see in Kabuki syndrome are atrial septal defect, ventricular septal defect, and coarctation of the aorta. Also, one of the highest incidences of symptoms seen in Kabuki syndrome is the loss of neurological functions, which causes developmental delays, autistic-like behaviors, and epilepsy, as well as infantile hypotonia.
Okay, so I'm going to be talking about the treatments for Kabuki syndrome, which is right here on the board. So there are no clear medical treatments for Kabuki syndrome, probably because it's such a rare condition, but there are treatments for every specific manifestation that can be seen. For example, with a confirmed growth hormone deficiency, you can have growth hormone therapy, which will help with that short stature, as well as it can help with that extreme joint laxity that is often seen in patients with Kabuki syndrome, as well as they often tend to have difficulty feeding, which tends to not allow them to gain nutrition. So using thick and liquid feedings as well as therapeutic repositioning after feedings is helpful for that. If that is not effective, then NG tube placement will be required. They do tend to have autistic-like behaviors and developmental delays, so special education treatments and psychobehavioral therapies are often used for this. Typical anti-epileptic drugs are used and shown to be effective to handle the seizures that are present in Kabuki syndrome. And then the typical treatment for heart defects is surgery. These surgeries do tend to have a high success rate and do improve their quality of life. And then lastly, the impact of Kabuki syndrome. So although there's not much research on Kabuki syndrome, obviously the extent of the symptoms present can allow there to be inferred negative impact on the patient's life in all aspects of their life. So due to the high prevalence of developmental delays, that infantile hypotonia can lead to speech impairments. Children with this disorder may find it difficult to participate in school and make social connections. And then affected individuals may feel physically weak and depressed by the amount of treatments and surgeries and the overwhelming number of hospital stays that they have to endure. So ultimately, it is imperative to have well visits to monitor their growth and their development, but they do have a good prognosis to making it towards adulthood. Just the quality of life is not known for these patients. Okay, so that concludes our presentation. Diversity is one true thing we all have in common. Celebrate it every day. Winston Churchill.
Sayonara!